I'm Judy Smith from Brookings, and I have very deep roots in Brookings, and I love this town. I keep my business in town every time I can, and I have a general practitioner whom I adore, Rebecca Vandy Kopp, and she's absolutely marvelous. And she recommended, when I went in to see her about the pain in my arm, that I see Dr. Neminescu. Now, that takes a lot of practice to say, but he's a sweetheart. Pain is not a strong enough word. I've had carpal tunnel in my right hand and my left hand. The one we're talking about is my left hand, and it's like hot acid starts in your arm and works its way down and then rotates in and out of your hand. It'll wake you up in the middle of the night. It doesn't happen terribly often during the daytime, but it was just something that was not bearable. So I said, I think I need to see somebody about it, and she recommended Dr. Neminescu. Oh, I liked him. He was very nice. He was very patient. He answered all my questions. I always take a list of questions that I'm going to ask whatever doctor I'm going to. I've learned to do that and mark them off, So I gave it to his nurse. He'd never seen me before. And when he came in, he said, "Oh, I liked your love note." I thought, I like this man. And he answered all my questions. Oh, probably a couple of months. I kept thinking it's going to go away, but it didn't go away. And he did not want to do surgery. I mean, that was the last resort as far as he was concerned, which I appreciated. He said, "We'll try a brace." I tried that for 2 weeks. Didn't do any good. He said, "We're beyond that." So then he explained the process of surgery. I've had 13 surgeries in my lifetime. It was just kind of he said it's an easy surgery. It lasts about 10-15 minutes. The recovery is easy. So when Dr. Neminescu said, this is going to be easy, I had therapy for 3 months with this hand because it was into my palm. This one is a little tiny incision here, so he could go under both ways. No therapy. I had to be able to touch my thumb to each finger and make a fist. That was my therapy. I could do it 5 minutes after I woke up from surgery. And I have not had pain since. He said it could take a year to a year and a half. He said bones and muscles heal fast. Nerves take sometimes a year and a half. But he told my family, I was kind of out of it yet, that it was so tight in there that he said she'll probably have immediate relief. And I did. Never had it since. And everybody was very nice. The anesthesiologist introduced himself. The nurses, each one of them introduced themselves. They were very patient, and yeah, it was a good experience. I didn't have any pain. Well, the incision, but that's nothing compared to hot acid going through your hand. It really was not that painful. It was difficult. That was another thing the doctor told me. You can't lift more than a pound with your left hand for 2 weeks. That's a coffee cup full of coffee. And you have to keep it covered for 2 weeks. That's so minimal compared to painful therapy for months, So, and I would practice my therapy, such as it was. So it was, just minimal pain. Afterwards, it was nothing compared to other surgeries that I've had. And he told me it would be nothing, so. I have 11 doctors on my portal, and it is a miracle. Anything that happens, for any of the things that I have wrong with me, I get on my portal, I send a message to my doctor, because then they can answer it when they want to and send it back to me, and I have never had to wait more than 24 hours to have a message returned from my portal. That's important to me, really important. If I go in and one doctor says, "Oh, let's see, you gave blood for Dr. Vandy Kopp," so they look up and see what that was. Well, then you don't have to do that again. Okay, that's great, My husband's had several surgeries here. I've had cataract surgery here. He's going to next month. I do my business in town if I possibly can. And because my husband used to be in economic development, if you don't have good medical facility, people are not going to live here. That's not an excuse in Brookings. You don't have that for an excuse. And especially, it's important for people of all ages, but retired people had better be fairly close to a good medical facility. My husband was in the emergency room several times. It's less than a 10-minute drive from our house to that's important. If we had to go to Sioux Falls for an emergency room, oh my, that can be fatal, So it's just important that it's close by. It's convenient for my family, it's convenient for me, so that's why.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.